an opportunity for some National Forum members to share what their organizations are doing to take down hypertension. We're going to begin with Selena Gore, the Chief Executive Officer of Women Heart. Selena, are you on screen? Do we have you connected? I see you there and coming off mute. Selena Gore.
Hi, John, and hi, everyone. Can I just say congratulations to the National Forum. This has been a really wonderful conversation. And as always, Women Heart is honored to be invited to the table. So I've been asked to talk about what Women Heart is doing to address uncontrolled hypertension. I would say there's sort of three ways we think about this. We think about the system level change that has to happen. And I'm so grateful to the speakers today who talked really about what the systems can do, must do in order for us to be successful in controlling hypertension. The second is community-based support. We heard so much already about community health workers, pharmacists in the community. But I also want to make a plug for peer support as a really important engine to provide guidance and just be there to encourage others who are, just needing some encouragement, right? And needing some motivation, some assistance to push along to deal with things that, if we have to admit, is really difficult to deal with. And having that moral support, I think, is really critical. And then the other piece, the last piece for us is importantly, patient-driven education and patient-framed education. And so with the system stuff, Women Heart is launching this year something called the Women Heart Care Network, which is really a platform designed to help women in particular, because that's our work, identify hospitals, health centers, heart centers, and clinicians who are committed to delivering responsive cardiovascular care. And we heard earlier from Dr. Leeson talked about hypertensive conditions during pregnancy. This is one thing that we want to make sure women know where they can go to get appropriate care. And beyond that, they're also just sort of think about women through the life course. We also know that hypertension or the incidence of hypertension increases as a woman goes through perimenopause and menopause. So that's another area where I think women struggle to find appropriate care. Many of you who know our work know about our Women Heart Champions. These are our peer educators who are trained at the Mayo Clinic. And really, this program bridges the gap between clinical guidance and lived experience of uncontrolled hypertension. And together, this forms the basis for shared decision making, a concept that the National Forum has long championed, and we're really proud to be a partner to that work. I guess the last piece is to think about the way Women Heart as an organization can advocate away from fragmented care pathways that Dr. Modelay talked about earlier, and of course, gaps in awareness that campaigns like the Million Hearts campaign and others are trying to address. And then importantly, the inequities in access to appropriate treatment and care. And that's something that we work with our partners, whether it's the National Forum, Men at Hearts, or other organizations. We are so convinced that we have to work in coalition with one another in order to move the needle on uncontrolled hypertension. And so Women Heart stands ready to partner with you all in moving this forward and making sure that the patients that we all serve have access to the exciting treatments that we know are coming our way. Thank you.
Selena, the work that Women is so valuable. I can't count the number of times that I have been so impressed in meetings at the White House or at briefings on Capitol Hill or at the Food and Drug Administration or in other settings by the Women Heart champions, the patients who Women Heart has trained to be such articulate, such effective and persuasive advocates for policy changes and for empowerment for women who have heart disease to take control of their destinies of their lives. And you really do great work. It's exciting to hear what you're doing on the hypertension prevention and control front. So thank you for being here today. Thank you for sharing what you're doing.
Thank you, John. Oh, can I just say one more thing? If anyone's in DC on the 12th next week, we have
Yes.
a congressional briefing on hypertension in women. Please come by. We'd love to see you. I'd love to say hi.
Yeah. Thank you very much for adding that information. That's not just a plug, that's important. All right. So next, we're going to ask Brenda Chitnindi from the Zambia Heart and Stroke Foundation to share what you're doing. So, Brenda, I think you're ready to go. Is that right?
Thank you. Thank you very much.
You're on screen. Take it away.
Sorry?
I said you are on screen, so please proceed.
You can see me?
We are pleased to have you.
Thank you very much. The Zambia Heart and Stroke Foundation, with other medical institutions, we had a May measurement month program that was in 2017, 2018, and 2019. This was the first time to conduct such program. We did for the whole nation of Zambia, where we were screening the community on hypertension, and what we found there was quite challenging, because most of the participants that participated, they never knew that they had the high blood pressure. So it was in this community we went through a very big challenge, because like women, they never want to, when they go to the clinics, they do not hide, I mean they hide their ailments. They normally refer them to traditional medications. That's the most challenging thing that we found. But with this program, we made sure that we had to screen almost about 10 million people that were screened, and most of them they were just living without knowing that they had high blood pressure. And even myself also, I had that chance to participate in this screening. I was living without knowing that I have high blood pressure until I was screened in 2017, when I was found I had a stage 2 high blood pressure, which was difficult. I couldn't believe it, because even the time I was going through this process, I thought it was other diseases, but I didn't know that it was high blood pressure. And through this program, we have done a lot of sensitization to the community, especially during the month of May. We have continued conducting sensitization awareness during the May measurement month, where we have also informed the population on this risk factor of of hypertension, because Zambia now it's getting worse now, and a lot of people are dying silently. So we have made a lot of progress in this sensitization, and even the policymakers have really appreciated us that they've put this May Measurement Month week on their national health program, where they have to do all the screening on BPs during the Health Week programs, of which we are very happy, and we have been commended for that. That's what I can say right now, because of the impact that we have conducted in the nation of Zambia, because there was no such activity done before. It was the first time that we did this May Measurement Month screening of a large population. But now we still have the challenge, because especially medication, most patients now, they have that attitude of trying to look at traditional medication, or we have a lot of programs now on social media where they're saying they have the cure. They have the cure, and a lot of people flock to these social media programs to get the medications from social media. But you find a lot again, they end up going back to the hospital because their position or the situation there is being deteriorated by this medication that they source from social media, and also the traditional healers. So we have a lot of work to do, especially on adherence. There's a lot of adherence in these medications. So we have a lot of work to do to sensitize the population, sensitize the patients on how to take these medications, not to stop taking medications, and they should be always checking with the health institutions to make sure that their position or their healthy situation is not deteriorated. So that's what
Tindy, it's really exciting, very exciting to hear that you screened 10 million people. I mean, that's a staggering number, very impressive. And then the work you were just describing to help people ensure that they're taking their medications as prescribed. We all know how important that is and what a huge impact it has. So congratulations on the great work you're doing, and we thank you for cutting into your evening there in Zambia, skipping your dinner hour to spend it with us. So thank you very much for being part of the National Forum and of this convening.
Thank you very much. Thank you.
Thank you, Brenda. We're now going to hear from the Association of Black Cardiologists, and their Chief Operating Officer, Nisi Johnson, is joining us. Nisi?
Hi, hello everyone. Thank you, John, for such a great forum. So we are very pleased. As mentioned, my name is Nisi Johnson, and I am actually Senior Vice President for Research and Global Strategy here at the Association of Black Cardiologists, whose headquarters is in Washington, D.C. Through professional and community education awareness and screenings, the ABC is really advancing our initiatives to address hypertension and hypertension control. One of our initiatives that we are most proud of is our ABC's Hypertension Certification Program in partnership with the American Hypertension Specialist Certification Program. Through this effort, the ABC sponsors clinicians and physicians to pursue a 10-year designation as a certified hypertension specialist advanced practice providers, and PharmDs, or certified clinicians or physicians. This certification promotes our efforts to strengthen the expertise in evidence-based blood pressure management and guideline-directed care. ABC also advances community education through resources such as our ABCs of Heart Health, Women and Heart Disease, 7 Steps to a Healthy Heart, Family Heartbeats Unmasked, and We Are the Faces of Black Maternal Health. These resources encourage individuals and families to better understand their cardiovascular risk factors, including blood pressure management and heart maternal health. Those resources are available through the ABC's website with the plug, abcardio.org, and I'll put that in the chat in just a little bit. We're also proud to participate with the American Medical Association's Release the Pressure initiative, focused on empowering all women for heart health equity through education, community engagement, and culturally responsive care focused on blood pressure management, as well as with the CDC's Foundation Hypertension Bites initiatives, which you'll learn about that a little later today, so I won't steer their thunder on that one. A major focus of what ABC's prevention work centers on our cardiology deserts program. This is where communities will have a cardiovascular disease burden that is higher than the norm, and access to cardiovascular care is limited. We take a two-pronged approach with the campaign, engaging both communities and clinicians through education, heart risk assessment, screenings, and prevention-focused outreach. We recently expanded our community health advocacy training program with programs in Melbourne, Florida, and Cleveland, Ohio, making a total of 11 sites nationally. These advocates help to extend our prevention messaging, encouraging, and in some instances, actually conducting blood pressure screenings and lifestyle behaviors, and to connect the community members to local health resources for follow-up care. And I will say that these clinicians are both clinicians and community health workers who are actually trained through an ABC's very intensive training program. Some of our upcoming activities will include ways to advance our work with NMA, the National Medical Association's conference that's being held in Puerto Rico this summer. And we'll participate in a hypertension-focused education and health risk assessments through the program and other internal medicine section. And more recently, we're excited to share that during a WNBA All-Star Weekend in Chicago, we will participate in partnership with Sneakers to Scrubs to provide some fireside chats focused on prevention and cardiovascular risk reduction. And the health and wellness outreach events will continue with blood pressure screenings as well. So we're really excited about that. So together, all of these efforts reflect our commitment to improving hypertension control and advancing cardiovascular health equity, not only in the US, but we're looking at a more global approach as well. So thank you again for this opportunity, and I'll put in the chat the ABC's website if you're interested in our resources. Thank you.
Thank you for that report. Very exciting work. Very exciting to hear you're reaching the WNBA crowd. I think that'll be a powerful amplifier. You're doing not just that, but a lot of terrific work. So the National Forum's proud of its partnership with the Association of Black Cardiologists, and we appreciate you being here to give us an overview today of what you're doing on hypertension. Thank you.
Awesome. Thank you so much. And we do appreciate our partnerships as well. Thank you.
Thanks. Next, we have Marissa Smith from the Maryland State Department of Health and Mental Hygiene. Marissa.
Hi, everyone.
Welcome.
Thank you. My name is Marissa Smith, and I am the Cardiovascular Disease Prevention Coordinator with the Maryland Department of Health. I'm based in the Office of Advanced Primary Care, where we lead and design implementation of the state's primary care transformation initiatives in collaboration with a number of state and federal partners. One of those initiatives is the CMS Funded Ahead model, which stands for Achieving Healthcare Efficiency Through Accountable Design. This model focuses on incentivizing primary care practices to transition from a fee-for-service model to a value-based approach, with an emphasis on improving quality outcomes and health equity. In my role specifically, I support the implementation of the National Cardiovascular Health Program. So this is a 5-year CDC-funded initiative on implementing and evaluating evidence-based strategies to prevent and manage cardiovascular diseases in high-risk populations across the state of Maryland. A unique and rewarding part of my role is being able to provide direct technical assistance to participating practices. I, alongside other quality improvement focused members of the team, work one-on-one with care teams to optimize practice level hypertension, heart failure, and hyperlipidemia workflows. We use techniques like process mapping, shared decision making, and quality improvement tools. We have found success in interventions focusing on addressing SDOH factors and improving structures of existing care teams. These interventions can include things like modifying workflows to better utilize clinical and non-clinical staff at practices, creating resources to connect patients with local community-based organizations, especially those focused on nutrition, or just strengthening follow-up and care coordination protocols for the referred patients. There are 500 plus practices enrolled through the Office of Advanced Primary Care. And so far in our CVD and hypertension specific work, we have engaged with 8 practices coming from diverse backgrounds across the state of Maryland. And we will enroll more in the final years of this grant as well. We are able to provide success stories, lessons learned, and best practices across primary care practices. And this has helped to spread effective and sustainable strategies statewide. So if you have questions or would like to collaborate or share ideas, please feel free to reach out. I can put the link to our website in the bio, but thank you. And thank you to the National Forum for such a great event.
Thank you, Marissa. Great to hear, and love, again, the emphasis on team-based care. It's such a strong, sturdy arrow in our quiver, and we all need to be firing it at hypertension a whole lot more so that we can take down hypertension. Glad you're doing it in Maryland. Thank you again for joining us. We're now going to hear from our friend Kwamel Hanks at the Academy of Nutrition and Dietetics, and Kenitra Joseph at the CDC Foundation. You're on deck. Kwamel, welcome.
Great. Thanks, John. Can you hear me?
Yes.
Okay, great, great. Well, thank you. We're excited to be here today, and we're excited, as always, to be a member of the National Forum. So the Academy of Nutrition and Dietetics is actually headquartered in DC or Chicago, but I'm based in DC, and I'm our Senior Director of Strategic Partnerships for the Academy. So at the Academy, our unique action to address hypertension is actually addressing one of the root causes, which is diet, by positioning food and nutrition as a central pillar of prevention and treatment. And so what we're doing is we are investing in and advancing the evidence base for medical nutrition therapy. And we've been doing this for a while, and we continue to build out the base for it. Through rigorous systematic reviews and evidence analysis, we're helping to demonstrate how tailored nutrition interventions, for example, sodium reduction, dietary pattern improvements, and providing culturally relevant counseling, can significantly improve blood pressure outcomes. So, for example, in 2024, our organization published a high-quality systematic review examining the effectiveness of medical nutrition therapy in individuals with hypertension, really reinforcing its role as a clinically impactful intervention. Secondly, we are also advocating for the integration of evidence-based nutrition care into healthcare and public health strategies. And so this includes elevating the role of registered dietitians as essential members of the care team, as well as promoting policies that expand access to nutrition services, including for populations that are disproportionately affected by hypertension. So overall, by treating diet not just as an afterthought, but really as a primary driver of health, our work is helping to reduce the burden of uncontrolled hypertension and improve outcomes that scale.
Kwamel, thank you very much. It's very exciting. We've heard in previous sessions about the importance of nutrition among different vital conditions for health and well-being, and as part of a complete therapy approach to preventing high blood pressure, to managing it. So we are so pleased to have the Academy as a partner and you personally here today. Thank you for joining us.
Thanks, John. We're glad to be here.
All right. Well, next up is our friend Kenitra Joseph at the CDC Foundation. Kenitra, the National Forum's really excited to be your partner, one of your partners on the Hypertension Bites campaign. And we know you're doing additional very valuable work on hypertension control. So please bring us up to date.
Thank you, John. I will say the feeling is mutual. We are very pleased to have had the opportunity to collaborate with a Hypertension Control Alliance that includes the National Forum, as well as AstraZeneca, the American Pharmacists Association Foundation, and the Preventive Cardiovascular Nurses Foundation on the Hypertension Bites campaign. I will share that through this campaign, we're focused on engaging people living with high blood pressure, uncontrolled high blood pressure, and helping them better understand why control matters, what the control goal is, and how to work with their care teams to achieve it. One thing we're especially proud of is that this campaign was co-designed with people living with hypertension themselves. Their experiences helped shape not only the messaging, but also the resources. We're working to strike that balance between urgency and empathy, acknowledging that the journey to control can be difficult, but while also helping people see that progress is possible. We're continuing to expand practical tools and resources for patients, providers, and partners, including new Spanish language materials that are launching this month. Before I close and share a short video, I do want to let you know that you can join our next webinar that's taking place next Thursday, May 14th at noon Eastern Time to learn more about a full suite of new resources. So you can register at hypertensionbites.org/register. I will put that link in the chat to learn more. But we'll share this short video that captures the heart of the campaign and the message that we hope people living with hypertension will hear and feel.
You've perfected the art of the shrug, the eye roll of indifference.
Whatever.
The small stuff is that, small. But high blood pressure, or hypertension, is different. It's danger. It's a call to act, because it's slowly doing damage beyond what you can see. Hey, you've been dealing with it the best you can, but you can always do better. Because hypertension is more than a heart condition. It can cause heart attack, stroke, even dementia. Dealing with it sucks, but you've been here before. So you'll do what you have to do. You'll seek treatment, track your numbers, and make changes for a healthier lifestyle. To be there longer, for the people who matter. There's lots in life you can ignore, but not hypertension. Hypertension bites.
I want to call out the really excellent work that you and your CDC Foundation colleagues did on messaging research. There is a lot of value for all of us in what you learned. We appreciate how you've shared it, and I would commend the tools that you all have developed to help others of us who are promoting hypertension awareness and control to take advantage of your good work.
Thank you so much, John. And looking forward to continuing to share. It's all available and accessible, so it's our pleasure.
Great, great. Thank you. And if you're not looking at chat, take a look now because Kenitra has put those links into the chat. So they're there to make it one click easy for you. All right, Kenitra Joseph, thank you again. Next up is our friend Sue Koo, the CEO of the Preventive Cardiovascular Nurses Association, better known as PCNA. Sue?
Hi, thank you for including me last minute. I really appreciate it. Great program so far, and thank you for having PCNA as a speaker and our president, Dr. Yvonne Commodore-Mensah. And just wanted to share quickly that PCNA has a multi-pronged approach to helping to make sure that we're looking at how to control high blood pressure. We share education at our chapter programs, in our virtual programming, and at our annual symposium. We have free downloadable resources, both for patients and clinicians on our website, so pcna.net. And as our president mentioned, we are embarking on a full campaign this year to help support our chapters in implementing community education and hypertension screening, which of course we're doing. We welcome other partners to join in on that and hope to have a full toolkit available just in thinking about educational resources and also how to implement at a community program. And thank you to the CDC, as we're partners for the Hypertension Bites campaign, and also to the National Forum. So check it all out at pcna.net, and happy Nurses Week to all. Thanks, John.
Happy Nurses Week, Sue. Thank you very much. National Forum really values our partnership with PCNA. We appreciate you being here to share your good work.
Thank you.
All right. Thank you.